Hello. Okay, so we're going to be moving on now to the digital artifact and doing step 3 to 5 of the 6-step ethical framework. So, step 3 is who are the parties involved? What are their views and what are their interests in the ethical study? So, the main parties involved in this case study is the patient, who is Mr. T, his family, which are his wife and adult children, the hospice nurse that is taking care of him, and the MDT, which is also known as the multidisciplinary team. Mr. T is at the centre of this dilemma. He has advanced motor neuron disease and retains full decision-making capacity. He has clearly expressed a wish to discontinue artificial nutrition and hydration in order to prioritise comfort, dignity, and quality of life. Mr. T's wife and adult children strongly disagree with his decision and wish for treatment to be continued. They express concern that discontinuing the artificial nutrition and hydration may represent as giving up, and that stopping treatment could shorten his life. Their views are influenced by emotional attachment, concerned for Mr. T's well-being, and the difficulty of accepting the progression of his illness. The hospice nurse is responsible for delivering person-centred, compassionate care while navigating the ethical tension between respecting Mr. T's wishes and responding sensitively to the family's distress. The wider multidisciplinary team also has a role in supporting this ethical decision-making, communication, and shared understanding. One key factor influencing the ethical decision-making in this case, is capacity. Mr. T is able to understand information about his condition, weigh the consequences of his decisions, and communicate his wishes clearly. When a patient has capacity, their views carry significant ethical weight, which can increase tension when others disagree. A second factor is values, beliefs, and identity. Mr. T values independence, dignity, and comfort, which reflects his identity prior to his illness. In contrast, his family's beliefs are influenced by a desire to preserve his life and protect him from harm. These differing values shape how each party understands what is in Mr. T's best interests. And the third factor is emotions and relationships. The family may be experiencing some pre-bereavement distress and fear of loss, which can strongly influence their reactions, which is completely normal in a situation like this. These emotions can place moral and emotional pressure on the nurse and make ethical decision-making more complex. Okay, so moving on to step 4 of the 6-step ethical reflection framework, which focuses on the ethical, legal, and professional considerations that underpin ethical decision-making in this case. From an ethical perspective, autonomy is a central principle. Autonomy refers to a person's right to make informed decisions about their own body and care based on their values and preferences. Mr. T retains decision-making capacity and has clearly expressed a wish to discontinue artificial nutrition and hydration. Ethical literature consistently emphasizes that respecting autonomy is particularly important at the end of life, where patients may prioritize dignity and quality of life over their prolonging their life. Born 2019 and Beecham and Childress 2019. In this case, Mr. T's autonomous decision carries significant ethical weight, despite causing distress to his family. Autonomy must be considered alongside the principles of beneficence and non-maleficence. So beneficence requires a healthcare professional to act in the best interest of their patient, while maleficence requires avoidance of harm. Mr. T experiences artificial nutrition and hydration as burdensome and prolonging his suffering, suggesting that continuing this intervention may no longer provide a benefit for him and actually instead be causing him harm. So ethical discussions surrounding artificial nutrition and hydration highlight that withdrawal from this treatment when it no longer aligns with the patient's goals of care is ethically distinct from causing death and may be justified when treatment contributes to suffering rather than a benefit. Ganassi and Ganassi 2006. Dignity and quality of life are particularly significant ethical considerations in hospice and palliative care. Dignity is a subjective concept and should be defined by the patient whenever possible. Beecham and Childress, 2019. For Mr. T, dignity is closely linked to comfort, independence, and identity, all of which have been significantly affected by the progression of his illness. The nursing ethics literature highlights that preserving dignity at the end of life may require prioritizing comfort-focused care over the continuation of invasive and burdensome interventions. Scott and Scott, 2024. From a legal perspective, the Patients' Rights Scotland Act 2011 provides a key framework. The Act emphasises a person's right to be involved in the decisions about their care and supports a person-centred approach. Legal commentary highlights that respecting patients' autonomy in both an ethical and legal obligation for nurses, particularly where a patient has capacity and clearly articulated their wishes. Dowie, 2024. In Mr. T's case, this reinforces the legal importance of respecting his decision while ensuring that care remains lawful and appropriately documented. Professional guidance further informs ethical decision-making, such as the Nursing and Midwifery Council Code 2018 requires nurses to prioritise people, preserve dignity, and practice in a way that is accountable and evidence-based. This places a professional responsibility on the nurse to advocate for Mr. T's wishes while also supporting his family with compassion and maintaining professional integrity. In addition, the National Institute for Health and Care Excellence, also known as NICE, guidance on end-of-life care for adults 2019 emphasizes shared decision-making, regular review of ongoing treatments, and reducing treatment burdens where appropriate. This guidance supports discussions about whether interventions such as artificial nutrition and hydration continue to align with the patient's goals of care and reinforces a focus of comfort and quality of life rather than prolonging a life alone. Together, these ethical principles, legal frameworks, and professional standards provide a structured and defensible basis for ethical decision-making. While they do not remove the emotional complexity of the situation, they support a patient-centered approach that balances respect for autonomy, minimizes of harm, and professional accountability. Okay, so we're going to now move on to step 5, which is what are the possible courses of action? So the first option is to support Mr. T's request to discontinue the artificial nutrition and hydration. This option respects Mr. T's autonomy as he has decision-making capacity and has clearly expressed his wishes. Ethical literature highlights that respecting autonomous refusal of treatment is central to ethical end-of-life care, particularly where treatment is perceived as burdensome and no longer aligned with the patient's values. Bourne, 2019, Beecham and Childress, 2019. Supporting this option may preserve dignity and quality of life and align with guidance that emphasizes comfort-focused care in advanced illnesses. National Institute for Health and Care Excellence, 2019. However, this course of action is likely to result in emotional distress for Mr. T's family, who associate continuation of treatment with care and hope. However, research highlights that family members may struggle with decisions to withdraw treatment, reinforcing that their need for clear communication, emotional support from the healthcare team is important. Kent, 2015. The second option is to continue the artificial nutrition and hydration in line with the family's wishes. This may provide reassurance to the family and it may prolong Mr. T's life in the short term. However, evidence does suggest that continuing life-sustaining interventions at the end of life can increase patient burden without necessarily improving their quality of life. Ganassi and Ganassi, 2006. In Mr. T's case, this option risks compromising his dignity and autonomy by continuing an intervention he experiences as painful and harmful, which is inconsistent with his identity and goals of care. When evaluating these options, supporting Mr. T's request to discontinue treatment emerges as the most ethically defensible course of action. This option is consistent with the ethical principles of autonomy, beneficence, and non-maleficence. It's supported by patient-centered care, legal and professional frameworks, and aligns with evidence-based guidance on end-of-life care. While the emotional impact of the family must be acknowledged and managed sensitively, ethical nursing practice requires that the patient's informed wishes remain central to decision making.